Okay, in this video, we're gonna talk about how the different phases of the heart cycle, that is the cardiac cycle, and how the heart sounds and the ventricular volumes and the JVPs, ECGs are interrelated. This can be asked as the questions, and it is very frequently. You should know, you should know this, and it's important. Now, the thing is that if you haven't seen my previous video on the cardiac cycle loop, please do watch it because everything is related to that only, and you need not to mug up because it will be instant click in your minds whenever you will see the question like this. Okay, so the thing uh, that is related to the previous video is we know the sequence of the phases of the cardiac cycle now, right? So we have the isovolumetric contraction that was between the mitral valve closure, this mitral valve closure, and the aortic valve opening, right? Then we had the systolic ejection, that is when the blood goes from the ventricle to the aorta. Between it, okay, systolic ejection was between aortic valve opening and aortic valve closure, this thing, right? Then we have the isovolumetric relaxation that lied between the aortic valve closure and the mitral valve opening, this point, right? Mitral valve opening, right? And after the mitral valve opening, we had the mitral valve closure, and between the mitral valve opening to the mitral valve closure, we have the rapid filling and the reduced filling phases. So these phases and the relation to the valves you must know. This is the only thing you need to remember. Now you know that S1 is produced because of what? Whenever mitral valve closes, there is S1. So we have the S1 that will see we are giving lines. These lines are drawn to represent the mitral valve closure, right, and the aortic valve opening. So from this line the S1 will start. When the mitral valve is closing, at that moment we will have our S1. And S2 is because when there is pulmonary and aortic valve closure, right? So where is the line of aortic valve closure? We will have our S2 there. After that line we will be having our S2. Now we know that S3 is a sound that is produced in the rapid filling phase. See, you can see it is occurring in the rapid filling phase. Now the thing is that you need to know when the S3 is heard. Whenever we have a heart, and like, if I draw it for you, so these are the four chambers of the heart, and there is mitral regurgitation in case, or like aortic regurgitations. So whenever there are increased filling and the backflow of the blood into the atria or the ventricle or anything like that, right, it goes back to the atria. So whenever there is huge amount of blood in the atria and it comes to the ventricle in the rapid filling phase, there is a huge gush of blood that comes to the normal ventricle, and due to that hitting, like hitting kind of blood into the normal ventricle in the rapid filling phase causes the S3. Now you can read from here, like in the early diastole during the rapid ventricular phase filling, so it is best heard at the apex because the gush of blood will be hitting on the apex, right, and it is associated with increased filling pressures, that is the regurgitations. See, make sure it is not stenosis. Okay. Okay, then also in hyperdynamic states it can be seen. Athletes, young adults, pregnancies, thyrotoxicosis, and turbulence is increased. So that's why it occurs. Then we have the S4. Now you know that S3 lies in the rapid filling phase, and S4 is basically the late diastole. Okay, late diastole, it is basically the atrial kick. Make sure you know that this is not a normal ventricle, this is a stiff ventricle. It occurs in the stiff ventricle. So when the normal flow of blood is coming and and hitting a stiff ventricle if at that moment of time the any sound is produced, it is the S4, right? Best heard at the apex because obviously this also is hitting the apex, right? In the left lateral decubitus position, high atrial pressure is there, okay, can be there, right? Associated with ventricle non-compliance. So S3 the ventricle is almost normal, but in S4 the ventricle is non-compliant. This you need to remember. So revising all these four heart sounds, S1 will occur in the isovolumetric contraction, S2 will occur in the isovolumetric relaxation, uh, S3 in the rapid filling, and S4 in the atrial systole.